Welcome back to this edition of EC3 HOSA Moments. I'm Shelby Miller.
And I'm Bailey Richardson.
And today we are going to be talking about diabetes with Michelle Copel.
Could you tell us a little bit about yourself and your background?
Sure. My name is Michelle Copel. I work with Lincoln Trail District Health Department. When I was growing up in eastern Kentucky, my grandmother had diabetes, so that fostered my interest in diabetes. It was something I didn't know a lot about other than seeing her take medicine and shots, watching what she ate. And so when I went to college, that was one of my big focuses. I ended up getting to do a week at diabetes camp, so that helped foster my interest more. And then I started working at Lincoln Trail District Health Department. I've been there for over 20 years, and I've taught diabetes ever since. So it's pretty interesting to me.
All right, and can you give us just a general definition of what diabetes is?
Diabetes is a disease system. What happens is with diabetes, for some reason, the body doesn't process the food that we eat like it should. It doesn't absorb the sugar like it should. So the sugars are broken down from our foods. And what typically happens is we have a hormone called insulin that's released, kind of opens up those cells, lets that sugar go in. What happens with diabetes is, for some reason, that doesn't work. With type 1 diabetes, and we think usually of kids with diabetes, what happens from the get-go with them is their body either makes very, very, very little or no insulin, and so they don't have those hormones to open that cell. So then they have to take insulin to be able to live. What happens with type 2 diabetes, they may not make enough insulin, or their body may become resistant to the insulin they have. And so what that means is the cells become resistant. They don't like the insulin as much, so it lets some of the sugar in, but not all that's supposed to.
Can you tell us how type 1 and type 2 diabetes are diagnosed?
Sure. With type 1 diabetes, like I said, typically it's children. Typically they're diagnosed early in life, although it can be later. We even have some adults that are diagnosed with type 1. But what happens is their blood sugar will start zooming. Of course, parents don't know that to start with, but they notice something's wrong because they may drink more than normal, they may have blurry vision, they may want to eat all the time, and they may even start losing a lot of weight. And so usually they're diagnosed very quickly. They're taken to the doctor, their blood sugar is done, or they do that through either a finger prick or a vein, and so they find out how much sugar is floating around in their blood. Or they may even do an A1C test, which is like a 3-month test. It gathers an average of what their blood sugar has been for the past 3 months, and then they can be diagnosed that way. They always go on insulin from the get-go. The difference with type 2 is they may have it for years and not know it, because some of the symptoms that go with type 2 are some of the same ones. We don't usually see the drastic weight loss with them, but we see more gradual symptoms happen. They get more tired than normal. They get more thirsty than normal. They may have wounds and sores that are slower to heal. They may have blurry vision, some of those things. But when you think about that, we kind of explain those away. Yeah, I'm more tired than normal. I'm not 25 anymore. Yeah, I'm more thirsty than normal, but it's hot outside, or when I turn the heat on in the winter, it drives me out, so I drink more. Common sense tells you if I drink more, I'm going to go to the bathroom more often. Yeah, I'm more hungry than normal, but I'm doing more. Or they may not even notice that they're more hungry than normal. And then sores and wounds used to be the one that I thought would get people. But when you think about it, how many times do we bump into something and don't even realize we've done it? And so if it doesn't hurt, we don't look at how long it takes to heal. Statistics say they may go 7 to 10 years before they're diagnosed. And typically with them, it's they start on diet and exercise, or diet and exercise and pills, diet and exercise and insulin or other injectables.
And could you tell us a little bit about gestational diabetes?
Gestational diabetes is diabetes during pregnancy brought on by pregnancy. The hormones change so much during pregnancy, and those hormone changes and fluctuations can cause issues with blood sugar. And so with that, it is a form of diabetes. Typically, like I said, it's always diagnosed during pregnancy. It's why it's called gestational. And typically it goes away after pregnancy. In some cases it doesn't, and it puts you more at risk for type 2 diabetes later in life.
Now, can that harm the baby in any way?
Well, with the baby, the way that works is when the mom eats food and it's broken down into sugar, if mom doesn't have the insulin and stuff to cover that, then that sugar does cross the placenta. So we hear of big babies, bigger than what they should be. Babies, because they get that extra calories and stuff from that extra sugar. And big doesn't always mean developed. Does that make sense? And so, yeah, it can cause harm that way. Now, does it make the baby be born with diabetes? No. But, because mom's more at risk, if mom gets type 2, then the kid is more at risk for type 2 as well.
Could you tell us a little bit about prediabetes?
Prediabetes is a condition all on its own. You may have heard the term borderline diabetes. There's no such thing as borderline diabetes. But that term was used, and people thought, well, as long as I don't cross the border, I'm okay, right? Now we use the term prediabetes, which means the blood sugar is higher than it should be, but not high enough to be diagnosed with diabetes. So when we're in those categories, that's called prediabetes, there are some things that are more at risk. For instance, if you have prediabetes, common sense would tell you you're more at risk for diabetes, which is absolutely true. The other thing is you're more at risk for heart disease and stroke just because you have prediabetes. They've done lots of work with prediabetes. They have found in studies that if you lose a modest amount of weight, and it doesn't have to be a lot, it's usually 5 to 7% of your body weight if you're overweight or obese, and increase your activity, they can help prevent you from going all the way to diabetes or prolong how long it takes to get there. So the study they done, what they looked at is the people that they made these changes and stuff, about 50% of them stayed in that prediabetes range. About 25% of them went on to have diabetes. And about 25% of them reverted back to normal blood sugars. So it made sense that this was very helpful, because even just prolonging the onset of diabetes, it's a lot different getting diabetes when you're 60 versus getting it when it's 40, because that's 20 more years for it to do damage in your body.
With prediabetes, are patients taking insulin?
No, not normally with prediabetes. With prediabetes, the medicine that they may take, if any, would be metformin. Typically what they do is diet and exercise.
Now, can you elaborate on the diets and exercise routines that they can do?
Well, for prediabetes, it's a healthy diet, so they would follow healthy eating. And like I said, if they're overweight, then they would work on some weight loss. So when we think about healthy eating, we think about that My Plate that you see. That's about half fruits and vegetables, about a quarter protein, about a quarter grains, and then some dairy added to that, and a little bit of fat, watching how much they have. And so, yeah, it would be that healthy eating. With exercise, they suggest at least 150 minutes a week, which when you think about that breaks down into about 30 minutes a day, at least 5 days a week. And when they talk about that exercise, they're talking cardiovascular exercise. So those things like running, walking, doing sports, dancing, biking, those kind of things. They do also suggest that you get some weight-bearing exercise, some through the week as well.
What are some common signs people experience when they think they have diabetes?
Some common signs and symptoms. Well, like I said earlier, for type 1 and for type 2, they may have blurry vision. They may be thirsty more than normal. They may be more tired than normal. Go into the bathroom more often. Sores and wounds that are slow to heal. And then that drastic weight loss, especially in type 1, are some of the most common ones.
Have you heard the term honeymoon phase, and can you explain that?
I have heard the phrase honeymoon phase, and what that is with type 1 diabetes especially, when they have type 1 and they finally, get diagnosed and get their insulin regimen and they start working on everything, they may go through a phase where their blood sugar stays really, really good because their body's doing that last oomph of controlling everything. And so when it does that, everything seems wonderful. It seems easy, all this stuff. And then the honeymoon ends and their blood sugars are more erratic. Some people don't honeymoon at all, some type 1s, and some type 1s may honeymoon for 2 years or more.
As a student, I've seen some people that have a pump. Could you explain that a little bit?
Sure. With type 1 and even with type 2, sometimes they use a tool called an insulin pump. What an insulin pump does is it tries to mimic what our pancreas, the organ that makes insulin, does in our body. They put insulin in that pump and they program it to give a little bit of insulin all the time because our body does what's called a basal insulin, which is a small amount all the time to keep our body regulated. And then when we eat or when something happens that we need more, the body would give us more. Well, when they eat, they calculate their carbohydrates, those kind of things, and they look at what activity they're going to be doing, and then they have a scale or a way to look at how much insulin they need for the carbs. And so they go through, count their carbohydrates, and give themselves that bigger amount of insulin when they get ready to eat.
If one of my friends were to have a diabetic episode, how could I help them?
Okay, and so I'm guessing when you're talking about a diabetic episode, you're talking about either a high blood sugar or a low blood sugar. And so with that, they may have a high blood sugar where they're really tired, they may be lethargic, or they don't want to do anything. They may feel like they have a headache, those kind of things. Their eyes may get blurry. And so what we want to do is we want to encourage them to test their blood sugar, see what it's running. And so if it's high, then they want to follow what their doctor has told them to do for high blood sugars. And we want to also make sure they stay hydrated, so we want to encourage them to drink lots of water.
And when their blood sugar is low, what precautions should we be taking?
Okay, when their blood sugar is low, some of the symptoms of that, they may start being shaky, they may be nervous, they may not make sense to you. They may be more irritable than normal. So usually they're sweet, nice people and suddenly they're biting your head off. That could be a sign that they're going low. They may just act differently, if that makes any sense. And so with that, what they need to do is follow guidelines for how to treat a low. So if they can still eat, take stuff by mouth, then we want to give them 15 grams of quick-acting sugar, maybe glucose tablets, and glucose tablets, it's 4 of them. A lot of people think they're this size or close to that size of almost a quarter, so they think 1's enough. No, we want to do 4 because they're about 4 grams each, so 4 of them would be 16 grams. So, and we want to wait 15 minutes after they treat. They may treat with juice, they may treat with other things. And so we want to wait 15 minutes. 15 minutes feels like forever if you feel low or if you're helping somebody that feels low. So you want to time that 15 minutes. When 15 minutes is up, you test their blood sugar. If they're back to normal, then we want to follow up with a meal or snack so they don't drop back down. If they're not back to normal, we want to treat again with 15 more grams until they do get to that normal. Once they get to that normal after 15 minutes, 15 grams, 15 minutes, then we would go ahead and follow up with a meal or snack.
Can you provide us some tips for diabetes prevention?
Sure. With diabetes prevention, like I said earlier, we want to look at what we're eating, we want to look at weight, what it's doing, and we want to make sure we're physically active.
Can individuals with diabetes live a long and productive life?
Absolutely. Many people with diabetes live long, active lives by controlling their blood sugars. You know, that is the name of the game with diabetes, because if your blood sugar is out of control, then you're at more risk for the complications that go with diabetes. And, you know, those complications are some of the things that would cause life to be shorter or cause damage to the body.
And is diabetes a reversible disease?
I've always learned that it's not, that diabetes is not reversible. It is controllable. And you hear that term a lot. People think, well, I'm following the meal plan, I've lost some weight, my blood sugars stay pretty normal. And so that is more control. So your diabetes is under control. Because what happens if they started eating differently, or if they gain their weight back, those kind of things, then chances are their diabetes or blood sugars would go out of control again. And so there's a difference. Now, people with type 1 who have had pancreas transplants, then yes, that would be more the reversible thing as far as that goes. But that's pretty extreme. As far as just controlling your blood sugars and stuff is more what we see.
And how early on can you know if somebody has diabetes?
Diabetes can be diagnosed at any time. People can get diabetes at any time. I've known people who were diagnosed as infants with diabetes, and I've known people that were diagnosed way later in life. So diabetes is not dependent on age. Although with type 2, we see it more often in people over 40, but we are seeing more and more of that in younger people as well.
How common is diabetes in Kentucky?
Diabetes is very common in Kentucky. Probably about 1 in every 12 have diabetes. So that's about 8% of the population. We rank 7th in the United States. You know, we want to be top 10 for so many things. Diabetes is not one of them, but we are there. And so we want to look at how we can make our state healthier. There's lots of reasons for that. When you think about some of the risk factors that go with diabetes, you know, we talked about signs and symptoms, but some of the risk factors are older people are at more increased risk for diabetes, and we have an older states. Other risk factors that go with it is sedentary lifestyle, and unfortunately we rank in the top 10 for that too. Also for overweight and obesity, again in the top 10. So we want to look at all those risk factors that go with diabetes and what changes can we make to make it a healthier state.
Is diabetes a hereditary trait?
Diabetes can be hereditary. One of those risk factors is family history that goes with diabetes. So yes, if you have people in your family that have diabetes, you're more at risk. They used to think that was more common with type 2, but they're even seeing that with type 1 now. I know several families who have more than one person in their family with type 1. And, you know, type 2 has always been associated with running in families. And so, yes, very much so. So let's go over some of those risk factors. Family history, age, overweight, sedentary lifestyle or not enough exercise. Some ethnic groups are more at risk for diabetes. African Americans, Asian Americans, Hispanics, Native Americans, and even now they're looking at putting Appalachian Americans in that. So those people have higher risk for diabetes. And if you had gestational diabetes, and some people a long time ago, or if they weren't diagnosed with gestational diabetes, we say, or if you had a baby that weighed more than 9 pounds, because they consider that a risk that you had gestational and didn't know it.
What are some local resources that people with diabetes can go to get help?
It's a great question. You know, of course, your family doctor is always helpful. There's specialists in diabetes called endocrinologists. And so what they do is they specialize in any of the endocrine diseases, and diabetes falls in that. The hospital has classes and things like that going on. Our health department, along with the local extension office, so Lincoln Trail District Health Department with Hardin County Extension Office has started healthy interventions for prevention classes, so to help with looking at chronic disease, so like diabetes, heart disease, cancer, those kind of things, through healthy eating, exercise, and healthy cooking. And we look at, well, you know, people with diabetes, they already have diabetes, but they may be trying to prevent the heart disease that may go with diabetes. And people with prediabetes may be trying to prevent diabetes. People who are overweight may be trying to prevent both.
Is diabetes considered a chronic disease?
Yes, type 1 and type 2 diabetes are both considered chronic diseases, along with prediabetes, and prediabetes may go away, but typically these diseases don't go away, and so they're long-term. If you're the lucky 25% that your prediabetes goes away, then that's great, but you still have it for a while and you're still at risk for it. So with that, when we talk about chronic diseases, especially with diabetes, there's complications that could go with that. And that's why we want to control our blood sugar, is to watch and hopefully not get those complications. When we think about that, diabetes affects anywhere your blood goes and anywhere your nerves go in your body. So your whole body can be affected by diabetes. What happens is your blood gets thicker with that sugar, and that sugar is carried around through your system. And so when you think about the little blood vessels in your eyes can cause eye damage, because those little blood vessels can be damaged, and that can cause your sight to be off when it gets to a certain point. Unfortunately, you may not have signs and symptoms of that till it gets really bad. So people should have a dilated eye exam at least once a year if they have diabetes, because what they can do with that is they look in to see what damage is going on and what they can do to help that, maybe before the signs that eye disease is even going on. So if you have little blood vessel damage in your eyes, you can also have little blood vessel damage in your kidneys, even if you don't have it in your eyes. So with the kidneys, diabetes is huge for making people be on dialysis, because our kidneys are a filter, and when those blood vessels and stuff get damaged in the kidneys, they don't work like they should. And so instead of just filtering out the bad stuff, they filter out some of the good stuff. They also put some of the bad stuff back in your system, which can cause, lots of things to go wrong. So when they filter out the good stuff, that's some of the stuff people can test in your physician's office to see if you're spilling protein, if you're spilling stuff that you shouldn't be spilling in your kidneys. The other thing they can do is blood test to see how your kidneys are filtering. And so all of those things to help learn if they have kidney disease and what they can do to help protect their kidneys. So when we talk about eyes, kidneys, then we talk about other damage. Lots of people think about your feet because we think about nerve damage, we think about blood flow damage. And with nerve damage, what happens is those nerve endings start being coated with that sugar, and so they start misfiring. And so you may hear people say they have pain, burning, tingling in their feet, and that is a sign that something's going on. Eventually, if those nerve endings get covered and they lose feeling in that foot, then they're like, oh, I don't have the burning and tingling anymore. That's not necessarily a good thing, because pain is our warning sign that something's wrong. So if I lay my hand on a burning stove, then I pull it off very quickly because it hurts. What if it didn't hurt? Then I might leave it on there until real damage was done or more damage was done. Same way with the feet. They may not realize that they've stepped on something. They may not realize they've hurt their foot. And if they don't have that pain sign, they may not notice how badly it's hurt. And so infections can happen very quickly and then end up losing toes, losing feet. The other problem is the blood flow. We have infection fighters in our body that go all over our body through our bloodstream. Well, my feet are the farthest away from my heart. So if I have a hard time getting my blood to flow down to my feet and back up, then it can't get those infection fighters like it needs. So we hear a lot about that. Heart disease and stroke. Again, if my blood flow is not like it should be, then I'm more at risk for heart disease and stroke. People with diabetes may be up to 4 times more at risk for heart disease and stroke. So it's very important that they get tests done every year. It's very important that they look at what's going on with them. They want to know they have feeling in their feet, because it's not like it happens overnight. Whoops, I don't have feeling in my feet anymore. It's very gradual, and they may not even realize they've lost feeling in their feet. So they want to get that tested, want to get their eye exam done, want to get their kidney test done. They want to make sure their doctor is looking and listening and making sure they have good blood flow with their heart and to their brain. The other things they want to look at is to make sure they don't have infection on their skin anywhere, because skin care can also be affected. Dry skin, People with diabetes may say, I have dry skin, because we talked about high blood sugar and how they get dehydrated, so the body is pulling moisture from everywhere, including from the skin, and so they may have to use lotion, those kind of things. If they do use lotion, we want them to use unscented lotion, or lotion that doesn't have the alcohols in it that carry the scent, because alcohols can be drying on the skin, whereas the other, not as drying. The other thing is, we don't want them to put it where two skin surfaces touch. That tends to stay moist enough, so not in between the toes, not if they have that stomach that hangs over a little, not down there, not under their breast, those kind of places, because germs need 4 things to grow. They need it to be dark, warm, moist, and have food around. People with diabetes are sweeter than anybody else. They have plenty of food around, and so those places tend to be more dark, warm, and moist. Also, we think about our mouth and how germs get in there. We want to make sure they're taking care of their teeth as well. So diabetes can affect everywhere, but we just want to make sure that people are taking care of themselves.
And I've heard before with patients that have diabetes that somebody special has to cut their toenails.
Sometimes, yes.
Do people with diabetes, is their blood more thin? Is their blood thinner?
Typically when people have to cut their toenails, it's because people with diabetes are more susceptible to infections and things. And when you think about fungus on your toenails and stuff, that can be an infection. So their toenails may get thicker and it's harder to see, and they're more at risk for infection. So we don't want them to nick their toes and stuff, because that can set up a place for infection to happen. And so sometimes they get their toenails cut by a specialist or a podiatrist, a foot doctor, because they're hard to cut, they're hard to see, or they're thick, and we don't want them to nick their toes.
Thanks, Michelle, for coming in today.
Thank you for having me.
November is Diabetes Awareness Month, and this month we are encouraging all of you to go get your blood sugar tested.
Thanks for watching this edition of EC3 HOSA Medical Moments.